So what I'm going to do with my coffee is, until we all get through this together, is I'm going to bring in experts in the field, and I'm so happy that folks have been willing to get up early and step up. And this morning is no different. Obviously, we have Janice Gilley here, the county administrator, and we've got Eric Gilmore up there. He's our emergency manager. But today our special guests are Dawn Rudolph. She's the president and CEO of Ascension Sacred Heart Pensacola. Dawn, good morning, and thank you for being here. And then we also have Justin Labrado, and he's the COO of Ascension Medical Group Sacred Heart, and he's here joining us by audio only. So that's him in the corner. Good morning, Justin.
Good morning. Thank you.
Well, thank you all for being here. Well, we'll just start out with some things that changed from just last week. Of course, last week we had Mark Faulkner from Baptist Healthcare, and we had a really nice chat with him and answered a lot of great questions. And one of the questions I had for him was about the whole thing about wearing masks and face coverings. Because the week prior to that, we had Dr. Lanza on board, and we had a really great chat with him 2 weeks ago. But I asked him that question specifically because there's been a lot of shifting guidance on that. And one of the things that he said specifically was, at that time, he said, you should only wear the masks if you're sick. And to me, that just didn't seem right. So I pressed him on a little bit. I said, a lot of places overseas, they wear them, on a regular basis. And we've seen in South Korea, they're wearing them. But that was what he told me. And then last week, I put that question to Mark Faulkner, and he said that there was some shifting guidance. But now, Dawn, tell me what you think about that. Why do you think that suddenly shifted to the guidance now that we're seeing that you should wear the masks?
Right, and Mark was correct. Our guidance has been shifting from the CDC. As we get it, we implement it. So over this last week, I got my little loop mask right here.
Yes, you did.
And so and blue side out, by the way, don't be a rookie and wear
blue side out.
Away, but blue side out. We've been offering them to everyone that comes through the doors, and so since I'm not in a clinical space, I wear mine when I go out on the floors. But when I'm in my office, I don't necessarily wear it. And it's just been this week that I thought about wearing it into the grocery store. So, it's a bit of a psychological thing in that, if you're not 6 feet away from someone, there's protective zones,
mm-hmm.
but, we can't always be 6 feet away from everyone.
Right.
So I think the guidance has been, as we're seeing prevalence in the community, we need to make sure we get our masks out. And so there has been some debate about it. Even here at Ascension Sacred Heart, we started out with the cloth masks,
mm-hmm.
that the community was making.
Yeah.
And, we were a little worried about that because it's not the same type of grade.
Correct.
As what we would have in the surgical mask. And so, but we want to support our community supporting us. So we just ask our associates that if they would wear their mask, they could put more of the cloth mask on top of it. So I think it's tiers of risk. And so, the safest thing to do is to stay 6 feet apart from people and
right.
then add the mask.
Oh, very good. Well, like I say, when I heard it this week that they had said, well, okay, by the way, you've got to wear them. And full disclosure, I am a contractor employee out at NAS Pensacola, Florida, and I know the Department of Defense has put out a directive as well. And so yesterday, going through the gate out there, the gate guards actually are wearing the masks as well. And it's my understanding, I guess, Pensacola Police Department is going to wear masks, and I believe the Sheriff's Office here and in Santa Rosa County is going to issue masks to the deputies and leave it to their discretion. Now, I'm a guy who works in an office. I've got my own private office. So, Dawn, I'll put you on the spot. If I should I wear a mask in my office? I mean, what do you think?
Well, I work in the hospital. Of course, we screen everybody that comes in.
Right.
So, with integrity, if people are saying, no, I don't have a fever, not a new cough, all the questions, then, we feel like we're at the safest level, right? Although
mm-hmm.
there is asymptomatic, persons out there in the community. I feel safe. I don't wear my mask in the office. But, if I know I'm going to be in a space, like in the mornings when I take my walk, I'm not wearing my mask. But going to the grocery store, I'm going to tell you, I think I'm going to be putting it on this week and going into any place that I think I might come in contact with someone. So it's kind of like your psychologically safe zone, Jeff. I would say you're going to be among people, put it on. You can't be too careful.
Yeah, interesting. 2 weeks ago when I went to the grocery store, I started to see people wearing the masks. And last week when I was in line to go and try and find toilet paper, I felt like I was at a science fiction convention. Everyone had the gloves and the mask. I was the only one that didn't have one. So now I guess this week I'm going to develop a complex if I don't start wearing the mask like everyone else is wearing.
Some of it too is we still have flu. We still have, bronchitis going on, allergies. People are coughing. And I think if they're going to be out in public, even though they may not have a fever, I think out of respect for others, people have been putting masks on as well. Like if they're coughing and have allergies, it's just a courtesy thing.
A courtesy.
I don't know if you've been in a room and you've had someone start coughing.
Ugh.
And people are like,
At church.
oh my gosh, exactly. So.
Well, hey, and that's a good segue for, I'm going to bounce it over to Janice. Janice, I got a question here from Rick, and he wanted to know about, and I guess I should know this too, how is the wearing of the face coverings going to be applied to county employees? Obviously, our EMS and our first responders wear them as appropriate, but what about folks that are working in the different departments?
So I would also mention that our ECAT drivers and our the staff at ECAT, and then also our maintenance employees are wearing masks as well. And so we do have a number of personnel that are wearing masks. We've also mentioned the CDC does recommend the mask, but it's not mandatory. And so what we've said is that employees that are comfortable or want to wear a mask, it's voluntary for them. And so we're not mandating it, but it is a voluntary option. I have had several conversations with folks that are kind of going the cotton/scarf route.
Yes.
Because they have those at home as well.
Okay, so so I'm hearing it's not going to be mandatory, or is it mandatory for our employees?
So it's mandatory for, like you said, our EMS, our fire, those folks. ECAT has been mandatory for over a month. We've provided them to folks for almost a month. And then our maintenance employees have also been wearing them.
Okay, very good. Hey, Justin, here's a question for you, because I know you're probably on the ground doing the operations and things like this. What we're seeing throughout the country is the shortage of PPE. And when I spoke with Mark Faulkner last week, he said, listen, Baptist Healthcare, they're not immune to the shortages as well. Just wondering how things are looking for you guys. I know that the president and the governor and everyone's working hard to ramp up the production, but how is Sacred Heart looking on PPE for your employees?
So we've been very fortunate. Ascension has kept us well stocked with N95 masks, surgical masks, gloves. I've probably used in the drive-through testing center over 3,000 of each.
Wow.
Since March 16th. We've also had many great community partners that are donating to us. My office is full of masks and gloves and things donated from the community. So we're actually in really good shape right now on PPE.
That's good. And a question. Last week, Mark mentioned something that I thought was really newsworthy. None of the news outlets picked it up, but I thought it was very key. He said they're using the ultraviolet technology right now. I guess they have a machine that can extend the life of a mask. Do y'all have that as well? Maybe I'm just way behind the curve, but I thought that was something pretty cool. Do y'all?
I mean, that technology's been out. We went a different route. We do reprocess our N95s, and there's a procedure that we're able to do that through our central sterile.
Okay.
Where we do our sterilization and cleaning of supplies and whatnot. So we've been working through that department. We do not have the UV, but we have a process to be able to reprocess our N95s.
Cool. Eric, I'm going to shoot it over to you, and I'm going to ask you. First, I want to thank you. Yesterday, I was on a call at 3 o'clock. It was a call with the United States Navy, all the COs of all the different commands at NAS Pensacola. It was facilitated by the Chamber of Commerce, and it was really great. But one of the things that I was able to provide to all those guys was our daily sit rep. And I don't know, Don, do you get our daily sit rep? It's really interesting. It's a roll up of all the county activities. You get a copy of that each day, I would assume, and Justin probably get it. But Eric, I want to just say thank you for getting that together for us each day. There's a ton of information in there, and one of the data points that I noticed in yesterday's sit rep was a mention of an assisted living facility that has a couple of outbreaks, and then Rick wanted me to ask which one that is. Are you at liberty to say, or is that something that we can discuss? Because I'm sure the families would want to know.
Right. So that's DOH's information. I'm not 100% sure that I can release that information.
Gotcha.
They brought a level 2 team in to try to mitigate the situation, and I think they're going to bring a level 3 team in this week. What the different levels do, I couldn't tell you, and I asked Dr. Lanza, he didn't expect we know either. So hopefully we'll find out together. But as far as the facility names, I don't know that I can release that. So
Okay. Yeah, that's what I was thinking. It was probably there's probably some privacy concerns there, but when I saw that, I thought, wow, that's because we see what happened in Washington State once it gets inside one of those closed quarters things. One of the things I've been concerned about from the county's perspective, Janice, is the prison, our jail, and that's a concern because you got all those. But we haven't really had any problems over there with respect to COVID, isn't that right, Janice?
We have not. It has not been reported to us at this time. I would also mention that those employees do have protective gear as well.
Okay. Well, I want to ask a medical question since Dawn, we're lucky we have you and Justin. We're very fortunate to have you getting up early this morning and joining us. And this is a question from Sabine. She wants to know whether or not there's a test that would determine whether or not a person's already had COVID, and I know why she's asking that question. There's a theory going around, and it's probably just a conspiracy theory that folks are like, wait a minute, back in January I had this real bad cold. I had a cold for a week in January. Several people in my office were out. A couple of their kids had to go to the hospital. Wasn't the flu, but they were out of commission for a week, and so. Part one of the question is, could this thing have really come through earlier? I mean, some people believe that it may have. And number two, is there a test that a person could take to determine whether or not they've had it?
Yeah, I'm understanding that there is a test out there, that it's a blood test, and you're looking for the antibody, right? And to see if you have that antibody in your system. And so I think it's out there. It's more of a retrospective test, like you're saying. Like, did I have it? Not as much as it active right now.
Oh, so that does exist.
Yeah, I believe so. Mm-hmm.
Okay, very interesting. Yeah, because I wasn't aware of that. And then this is another question from Sabine as well. If a person's in the hospital and say they have an underlying condition, cancer or heart disease or some other issue, but they also catch the coronavirus and they unfortunately pass away, do you attribute? How do you classify the death? Would it override the cancer or the heart disease? Would you say it was definitely COVID, or how do y'all make that call?
Well, right now, we're required to report any death that is COVID related to the Department of Health. This is a public health crisis going on right now, so we want to track all of that. So it would be reported as attributed to COVID.
It would be. Okay. Yes. Interesting. Okay, let's shift gears here, and I want to ask you this question. Obviously, the Board of County Commissioners, we last Thursday voted to keep the beaches closed indefinitely until we take action again, and we did that initially based upon a letter we got from you and your counterparts, your peers, that the executive directors of the hospitals. How important do you think that decision was? I mean, I got a lot of emails. In fact, I'm still getting them today saying, can't you just open it up for people to go fishing or surfing? From your expert vantage point, why was that so critical for us to do that? Don't mean to put you on the spot, but.
Well, I think you're asking me, Jeff. So
I am.
I signed the letter. I'm not a sociologist or human behaviorist, but they're magnetic. Those beaches are gorgeous, and they draw people in for all the right reasons. They're beautiful. They're well maintained. This is a hidden gem, is what I was told when I moved here. You found paradise, and to be the only beaches open across the Gulf Coast, would be a magnet for people, not just in Pensacola. You'd be bringing people in, from southern Alabama, New Orleans, and Alabama is a little bit ahead of us in this as we're watching, their prevalence rates. And so I think that's what was important, not for the locals, but it was almost protecting the locals from everyone else coming in. I think the governor said it, please stay home,
Right.
Come visit us in June when we're through this and everybody's on the mend. And I think, even the mayor mentioned something like that. This is such a place for tourism, that why don't you come when we're ready for you? And so I know it's been a sacrifice. Believe me, it is difficult for, I live downtown, so I love going out there. And so I've missed it as well. But I think, it's prudent. Mm-hmm. I think it was the right thing to do. We can't, stop everybody at every border. They're
Correct.
Still coming through, and we're still asking them to self-quarantine. We don't know if they are. And so I think it was the right decision at the right time to keep us, as flat as possible on that curve.
Well, no, I appreciate it. That's a good answer. And when I had my coffee with Dr. Lanza, and we were talking about the value and the benefit of being outside, getting the vitamin D, getting the fresh air, and he said, it's great that you can go to a park, and that's what spurred my question. I said, well, wait a minute, our biggest park is our beach, and I said, so what, scientifically speaking, what's the difference between going to the park and getting sunshine or going to the beach? He said, well, there's no difference. And that's where that conversation kind of came. Well, then why are our beaches closed? But, obviously subsequent to that, I got inundated with emails and things of this nature. And just as you said, Dawn, we would become a magnet. People would be out here. But I will say, now, Janice, you're probably aware of this. This Cocoa Beach has now put something out to where they're going to allow active use of the beach, fishing, swimming, running, jogging, walking, but not lounging, not putting out a towel and hanging out and building a pyramid with beer cans. So what about something like that here? For just locals? I mean, I'm just saying it. I don't want the news to report that I'm in favor of it. I'm just curious, what would your opinion be of something like Cocoa Beach, what they're doing?
Well, I've read it, and I think it looks like a pretty smart alternative in terms of trying to balance the enjoyment of the outdoors with, I think, as Dawn and you both said, the treasure that we have here. I think that the management of it is exactly what we've been discussing since that very first conversation with Dr. Lanza. You all had to take action because we, for whatever reason, weren't completely convinced that the public would follow the rules in terms of, not having large groups, come together and potentially, spread the contamination or the virus. And so, I think we could be very creative, as we've mentioned, in terms of utilizing our lifeguards and you maybe utilizing some of our code enforcement officers and one of our animal officers that we have on the beach, just to try and keep, the peace. I have not looked at any videos of Cocoa Beach, so I would want to do that and
Sure.
see kind of how they are able to manage it, and if the citizens have responded appropriately to the liberty that has been given to them. I have been trying to look at Georgia and South Carolina. As I understand, they've also kind of opened some of their beaches this past weekend with similar restrictions.
Well, just to be clear for anyone that's watching and wants to write an article about my position, I'm going to defer to folks like Don Rudolph and the experts, which I did last time when I made my vote to just keep the beach closed. But when I heard about Cocoa Beach and what they were doing, I figured, this would be a good panel to ask the question. Well, I'm going to shift gears to now really where the rubber meets the road in this whole issue, and that's the testing. We've been getting, and I want to compliment Janice and Eric and the whole team for getting us this daily report. I know there's a little bit of hiccups. One of my counterparts wanted it presented a different way, but I think the cumulative report that we're getting that shows the total number of tests that we know we've administered locally, total number of positives, negatives, that's very helpful. But what we see is still about 1,500 tests that for which we haven't got results back yet. And I know Ascension, Sacred Heart, you guys are the leaders. I think you were the first ones to do the tests locally, and I believe you have your own in-house capability. What is the lag? What is the reason for the lag? Is it the reagent? What is the specific reason for the lag time in the testing?
Hey, this is Justin. So since we started on March 16th, we've used 4 different labs, and Quest was one of the labs that we had anywhere from a 5-day to a 12-day delay in getting the results back.
Wow.
And we had stopped using them. So actually, as of Sunday, we're using a new lab called GenetWorks, and we should be able to get results back in 48 hours. So right now, our drive-through testing center since March 16th, we've tested 3,184 people. So 3,184. Only 329 tests are outstanding, and those tests go back to just Sunday.
Okay.
And all of those are with GenetWorks now, so I should start getting the Sunday and Monday results back today.
Okay, so you think we're really going to catch up, and this lag is. And now, what about? Are you guys? Is it a seamless handoff of the results to the patient and to the health department? Because their dashboards is really even further behind. Last I looked, they were reporting 2,075 tests, and we know we've conducted over 4,000. So is that a seamless handoff, Justin, that's happening?
For the patients, what we do for them is we call every patient personally, whether it's positive or negative. We've had 150 come through our drive-through testing center. And we follow up daily with the positives just to see how they're doing, to make sure, we can't do anything to help them, because our end goal is to prevent the hospital surge, right?
Yes.
We want them to get well at home. And so I think, the communication is huge. Our hospital, Dawn's group, they actually report everything to the Department of Health, inpatient and outpatient, and they do that daily also. So I think the communication is very smooth. Now, I'm a CPA. I love looking at the data too. And you see that variance on the daily report, and then what I see from the drive-through testing center, and I wish I could explain it, but there's obviously a lag there. And when I talked to Dr. Lanza, he said it'll probably take until, this is all said and done before the numbers catch up on the Department of Health website.
No, I appreciate that. That's a question that's been on my mind. Now, sticking with the medical stuff, since you guys are here specifically, I love the fact that you guys, and when I say you guys, I mean Sacred Heart, Baptist, and West Florida, are now letting us know the total number of beds, total number of ventilators, total number used, total number available. Right now, this morning, as of yesterday's SITREP, it shows that we have 165 ventilators available out of 218. And I've been talking about that for a couple of weeks. I don't know if you remember, Dawn, at the meeting, that was a question I asked each of the CEOs, because I think that's an important metric that we need to measure, because I think it gives us an early indication of whether or not we're going to have the same kind of an issue as New York and some other places where they're. But it seems to me that at 75% of our ventilators available, which is what that equates to, we're in good shape. Would you agree with that, Dawn?
Yeah, in fact, we were had a call yesterday with some leaders at Baptist, and we were kind of talking about how we're coordinating. Should we move into a surge? And we were talking about capacity, and we might say green, yellow, red. As we move into the surge, they may see tier 1 through 5.
Right.
But basically, we feel we're green, and they're at a tier 1. So that means we're kind of sitting ready, to respond. And so as this evolves, we saw our inpatient census double over 4 days. We went from 3 to 6, from Saturday to Monday. And so Justin's a numbers guy. I look at trends, and so I was looking at that going, this will be very interesting to see where we're sitting on Saturday. Will we see that same change in our census, and then how many of those patients are on event? So how we communicate and coordinate that, I think later on today, we actually have a call with Eric and Janice to just keep those lines of communication open. But for right now, I don't want to speak for Baptist in
Sure.
West Florida, but it feels like we're all at about the same place.
Yeah, well, that's fantastic. And it looks from yesterday's SITREP as well, it looks like we're right about 50% of our total beds available, which I think is great news for the listeners and viewers. I think one of the things that happens locally, and I've had calls and I've had folks ask me about it, is they watch the TV reports from other places. They see New York, they see the issues in New Orleans. But I think what we're seeing here is each location has a different experience. Like Washington State now, I believe they're sending ventilators out to New York because they assumed they would need a number, and they're finding that their experience there is different. I think our experience is shaping up to be a little bit different as well, but I mean, I guess it's too early to look at trends, but the fact that we have 75% of the ventilators available and 50% of our beds, I think that puts us in pretty good shape. But Eric, let me switch it over to you, because we see the governor of New York doing the daily press conferences, and he seems to know, like, hey, here's where we are on the curve, here's where we are in terms of hitting the apex. Are you, or Janice, or anyone from the county, are you guys working with Dr. Lanza to kind of figure out where we might be on that curve? Because some people think, we're over it. I've seen my counterpart put some things online that we're over it. But then we saw a big jump over the weekend in cases. Is someone looking at that, and is anyone willing to make an educated guess about that, or where we're at?
We get a discussion absolutely daily about where we're at, and it's all speculation at this point in time. The one model out there is the Washington model we keep looking at, that they keep testing numbers, and they seem to think that we're going to be at our apex sometime next week. But that's about the only modeling we have. We haven't heard anything out of Tallahassee or the state leaders about where they think what modeling state should be using or where we're at. So it's all speculation at this point, but we are definitely watching this hot and heavy. That's why we do the SITREP, so we can kind of, as you said, see where our bed capacity is, and Don's trending, and those guys, and then Janice and I are having our weekly calls with the hospitals, because we want to make sure we're leaning forward and it get caught behind the 8 ball when we're at the point where they're ready to surge or do something different and change gears to make sure that they have the capacity. So,
and about that SITREP, that's available for public consumption, right, Janice? I mean, there's nothing top secret? Because I've shared it with folks. I shared it with the military commanders yesterday. I mean, is that a public document that we can share?
I mean, I do not see anything in there that I think is absolutely confidential. Eric could correct me if I'm wrong, but I think it's a fine document to share.
Okay, Eric.
It's a good document. As a matter of fact, the media, they have access to WebEOC. Well, they should have access to WebEOC as a read-only, so they can see the boards, and they have availability to it as well. So.
I have a question online from Tracy, and I guess this would be good for Justin since you're like the guy out there doing the testing. Some homeless people have been tested but cannot get the results because of the nature of their transiency. Is there a plan in place to contact homeless folks who've been tested? That's a good question.
Yeah, that's a great question. So we partner with Community Health Northwest Florida, and they right now have their Brownsville and Cantonment site, and I've heard some of those issues come up at those two testing sites more than what we've seen at Sacred Heart. I want to get these results to them as fast as we can. I don't know of any positives that have come back in those situations, but there are situations where we have called multiple times on the phone numbers that they've left us, and 4 or 5 phone calls, and haven't been able to get hold of people with negative results. But as far as positives, I know we've been able to get hold of all the positives that have happened so far. But I'll work with Community Health and make sure we have a solid plan for that, because we don't want anybody to slip through the cracks.
Okay. Yeah, and that's a great question. And then I have another question from online. Is the county putting together data for each of the years 2016 through 2020 on a weekly basis of the deaths? I know the CDC does a weekly morbidity mortality report, but does the county drill down? Because some folks would like to know. I mean, obviously we only had 2 deaths from the COVID, but if this thing starts to get bigger, what the difference would be between like a normal and what would take place because of this? I mean, are we looking at anything like that yet, or are we not got to that point yet?
So, Eric, would that be something that FDOH would do through their statistical analysis? Do they monitor that type of data?
I'm sure they could pull that report through the vital statistics
Right.
data. So, but I don't know that they're watching it. We haven't had that discussion specifically about that topic stuff. I can ask. That's no problem.
Dawn, let me ask you this, and Justin. We're all hearing about this magic cocktail of hydroxychloroquine and zithromycin that, there's certain evidence that says it might help folks. Is Sacred Heart in Pensacola utilizing those medicines for the COVID patients that you're seeing?
Our doctors have been discussing it. They've been tracking right along with all the latest research and science, and so there's been some innovative ideas out there. I'm not aware that we're using it at this time. We just have one patient in the ICU at this time. I would have to check in and see, but I know there's been a lot of email traffic around not only that cocktail, but some of the blood transfusion and
Yes.
some of that work as well. So I'm sorry I don't have a more explicit answer, but I can tell you there's a team of doctors, taking in all the different innovative therapies that are out there and trying to discern, does it make sense here at Sacred Heart?
And let me ask you and Justin this question, because we hear about all the hospital workers. And first, let me take this opportunity. I'm sure I'm speaking on behalf of everyone at the county and thanking all the doctors, nurses, technicians, everyone that mans those hospitals in this time that we're dealing with. I mean, you think of folks that really make a sacrifice, and I really appreciate if you would please express our appreciation to your staff, Dawn, for everything they're doing, partnering with us, the testing in the community. I mean, really, it is amazing what you guys do, and so I just want to express my appreciation. But with that said, what kind of a toll is this taking on your staff? I mean, I know you guys have your finger on the pulse. Is staffing a challenge now? I mean, where are you guys at with that?
Well, thanks for asking, and thank you for your support. I would say I've just been blown away by this community. I mean, I just got here last October, and I knew it was fantastic, and the people here have been so welcoming. But the support that we've received, we are getting meals. We're getting donated meals from restaurants that I know are struggling.
That's awesome.
We're getting treat baskets from faith communities. Just as Justin mentioned, private practices are donating supplies. I mean, it really does inspire our team. It refreshes them. it's just a love. It's so much love out there. It's just been great. Their toll is, constantly wanting to do the right thing. They want to give the best care to the patients, and I think it's been a little bit of a and we're adrenaline junkies. We like to jump in, and we're doers. We want to, take care of people. It's been difficult as the guidance has rolled out.
Yeah.
New information every day. Okay, well then I want to do it right. I want to do it well. And so, just this consumption of all this new information, I think has been, a little bit of, they're learners. They want to do the best thing, but it's a lot every day of like, what's the new guidance? Are we doing this correctly? Did we get it operationalized? Should we have done that yesterday? We're doing it today. What are we going to do tomorrow? We've worked through that, and I think the past couple of weeks have been really good and just ramping up, being ready for any sort of surge. But, it's like, we're kind of waiting for this to happen. And they've been great supporting each other. We have a private Facebook page, and people have been posting things and giving a lot of support. I would give a specific shout out to all the frontline staff. We pushed a lot of people to work at home. That got them out of their comfort zone, and we're doing meetings online with our non-clinical based associates, and so we've had to change there, and that's been a change for sure, but we're working through that. The units that are, just waiting to get those results back to understand and dealing with the families. I mean, I think our visitor restriction has been really hard. We want our families close. We want them to be communicated to, and not being able to allow sometimes the whole family to come in and just one visitor or now none, in certain circumstances is really a toll on our associates. So I admire them. I'm inspired by them every day. They show up every day. They're willing to do whatever it takes. They're willing to be reassigned. They're willing to learn new things. I think we have as much communication back and forth, taking their ideas and trying to put them into place to, our conservancy efforts with PPE. Hopefully they feel engaged, but it is a marathon and not a sprint. And
Yes.
we have to remind ourselves of that every day, keep that adrenaline where it needs to be so that we can come back tomorrow and attack it in the same way.
And that leads me to the next question. I guess this will go to Justin. Justin, can you guys sustain the pace? I mean, you're the COO. You got your boots on the ground. Staff-wise, resources-wise, can you guys sustain this pace? Or if the tempo increases, how's Sacred Heart going to be able to meet that challenge?
So, we have about 100 different doctors' offices in our medical group, scattered from Moss Point, Mississippi to Apalachicola. And I've been shocked at the energy level of all of our doctors, nurse practitioners, physician assistants, and all the staff. What's interesting is, the volume is less than 50% of what it was in the past, because we're deferring the, like wellness visits, for example. We're deferring things that they shouldn't come into the office for. But what we've started to do is all of our doctors are learning virtual medicine. So in the last week, we have done 1,800 virtual visits.
Oh, wow.
So it's one of those that, and I've got one of my doctors, Dr. Pravat, he's 89 years old. Dr. Pravat is doing virtual visits right now. So it's another one of those things we talked about earlier, social distancing. Just have them see the doctor from home. And that's another option that we're doing of patients coming through the testing center. If they do need to see a doctor, well, we tell them, see them virtually first.
Yes.
And then come in after that. So it's a great option. But our staff is completely energized right now, and we're on day 24 of the testing center. Who's counting? But our team is they come in at 6 in the morning, they leave at 10 at night. This team has such a high energy level, but every result that we get back is important to the person that took that test. So we want to make sure we get it back to them as fast as we can.
No, that's fantastic. And I guess I didn't think, but you're right. All the elective procedures have been put on the back burner. So, everyone thinks that you're at this up tempo, but a lot of your offices are probably idle right now. So that's interesting that you're at 50% volume. I wouldn't have thought that. Great data point to know. Sally is online, and she's asking a question. Are you testing your employees at Sacred Heart who may be in contact with folks, and how does that process, what does that look like?
So we follow the CDC guideline for testing for our associates and everyone else in the community. I think everyone knows we have a screening call center, and actually our associates use the same screening call center as everyone else. We phone screened almost 11,000 people
Wow.
since March 16th, and that includes our own associates. But really, the one thing that people ask me is, if you have no symptoms, should you be tested? And the answer is no. So that's with
No.
our associates. So my team, who has seen 142 positives come through the drive-through testing, none of them have been tested because none of them have any symptoms. But if our associates have symptoms, meet the CDC criteria, then we'll end up testing them. And right now, that's somewhere between 30 and 35% of the people that call our screening call center meet that criteria to be tested.
Okay, that's great answer. Here's another thing, kind of like the masks, where the guidance, what we've been told, and when I say we, I mean the general public, has kind of shifted and changed. Initially there was the thought that you could not spread it if you were asymptomatic, but now what I'm seeing in a lot of different reports in different places is the 2 to 3 day period before you begin displaying your symptoms, you are. You could be contagious. So, what would you say? How likely is it that we're going to have a rapid test that's going to be available to every citizen? Because a lot of folks, they're anxious. They're around people. Oh my gosh, this guy I was around yesterday was sick, and I was at the grocery store and people were coughing, or whatever the case might be. Do you think, Dawn, that we're going to get to a point where everyone can get a test, one of these, like a home kit? And how long do you think that would be?
I don't know about a home kit. I know, Justin, you were looking at the Abbott, the rapid testing that could turn it around really quickly.
Yeah, so, the Abbott testing, that's a 15-minute test. Our ministry in Jacksonville has that right now. The one thing is it's about an 85% accuracy rate.
Oh,
while
okay.
Everything else that we're doing right now is 99% plus.
So you sacrifice accuracy for speed, in other words.
Exactly. And then you might have to do double testing just to make sure you don't have a false negative or false positive on those. So, I'm thrilled right now. If we can get the 2-day turnaround, on our drive-through testing, that's a huge leap forward for where everyone was a week ago or 10 days ago.
Well, I just have another question from online from Jenna. She wants to know how far behind South Florida is Northwest Florida on the community transmission timeline. Does anyone want to weigh in on that?
I would just offer that, the same model that Eric mentioned earlier, the IHME, which you can, find online yourself, it shows for all of Florida. It's like all the United States, different countries, and then it goes state by state. I don't think the models get down to county by county. They just haven't taken it to that specificity. So we don't have anything out there that the data scientists are working on. We're just kind of anecdotally seeing how they're ramping up versus, how we might be ramping up in Northwest Florida. I can say for Ascension, we have hospitals in Jacksonville, and they seem to be just a little bit ahead of us. And then as well as Providence over in Mobile, we've seen their census uptick a little bit ahead of us. So, we're just kind of keeping an eye on it. I don't have a perfect answer, I think, for your caller, but just to say that, we're trying to watch our region as well as the state.
And do you know if we have our own regional model? I mean, I thought I heard someone say we don't. Okay.
No,
Well,
it's a Florida model, right, for when we're going to peak.
Okay. Well, there's just, there's so many different things. The other question that came in was about back to the homeless. Are the homeless more susceptible because of their living circumstance than say, a person who lives in a house? Is that?
Well, they live in sometimes an environment that isn't, as sanitary as other environments, potential access to hand washing and those type of things. I think that is a vulnerable population any way you look at them. And so I would say, yes, they are more vulnerable. They have exposure to all the contact services. They're transient. They're not self-isolating in one place. So, we always think about that population as being vulnerable.
Well, let me ask a hypothetical question. Since we have the experts here, say you're a guy who works in a small office environment, say 9 or 10 employees, mixture of offices, cubicles. What we saw with Channel 3, obviously they had a couple of their team members test positive, and they've cleared out the whole office. They've done a deep cleaning. Now they're doing a team news broadcast with with a Mobile station, which is kind of interesting. But if it's a small office environment like that, and you know, unfortunately, someone tests positive, do you have to clear out the whole office? What do you do? I mean, do you not come to work if you know one of the guys you work with in that small office environment tested positive? Anyone want to weigh in on that one?
Yeah, this is Justin. So we have had multiple offices across the Gulf Coast that have had either a positive patient come through or there was a positive employee. And we had those offices deep cleaned, then we closed it down the second day, and then we reopened the third day. And
Really?
we've had no issues.
Okay,
So I've done that 8 or 9 times already.
Okay.
And have had no issues.
So again, the steps would be obviously the person who tested positive, he's out of the equation. The rest of the office clears out for a couple of days for a deep cleaning, and then you think third day back would be safe?
That's been our rule of thumb. So we have Ascension has been good with giving us the cleaning criteria that we needed to do, and actually we didn't have enough cleaning supplies to do it ourselves. So that's why we ended up bringing third parties in, and they had the right cleaning products, and they could do it fast. They've got the teams that can come in, and they can do it in a matter of a day. We probably could have brought them back the next day, but we just wanted it to just sit one more day because we saw some early data that said you needed a couple days, for the office to sit. So, but yeah, day 3 we've been open in our medical facilities and have seen no issues.
Okay. Well, we're running a little short on time, but what I'd like to do is offer Dawn the opportunity for you to say anything to the folks who are going to watch this. I'm going to have it on my Facebook page, and we're going to leave it up. So is there any message that you'd like to give the community from Sacred Heart's perspective? And Justin, I'll give you that same opportunity after. What can we do to help you in what you're doing?
No, thank you for that opportunity. I would say to the community of Pensacola and beyond, thank you for your support. Thank you for your confidence. Thank you for your trust. I am pledging to you that every associate here is doing everything they possibly can to respond to this public health crisis with their full heart and passion and vocation. And so your support of them means a lot. They are truly on the front line. They are inspiring people. And I'm also very proud of our organization at Ascension during this time, as we've had, some capacity with deferring elective surgeries, as well as just, seeing our census behind what we normally see. We've had full salary continuation for those associates, so we want to bridge them through this and bring them back and be ready for whatever life brings us, as we get through this. So we've been here over 100 years. We'll be here, as long as you need us, and thank you for your support. It's been wonderful to see.
Absolutely. Justin, would you like to say anything to the folks?
Yeah, absolutely. Please keep up the social distancing. Please keep up with the testing. I think if we can keep those 2 things, we're going to prevent a big hospital surge in Pensacola. Call the screening call center if you have any questions. I have my team is 100% clinical that answers the phone. That phone number is 850-746-2684. We will take care of you if you live. So we've actually have positives back from 7 states that have been tested at our drive-through testing center. So we will take care of anyone, no matter where you're from. But please call the screening call center because we want to make sure you're taken care of.
And your emergency rooms during this time, I mean, I guess that's a question people have. I know that there are some community clinics and free and charitable clinics that are staying open through this crisis so that they can take care of folks who, don't have diabetes medicines and things of this nature, and they have these other. Is your emergency room? Have you noticed a lot more pressure on your emergency room in particular since this has started?
I would say any more pressure. I mean, we're busy all the time, so we've had to change operations a little bit. We have screening outside of the emergency room.
Yes, I saw the tent. Yeah.
Yeah, you should. We've had to limit our entrances, and so we just. They've been an incredible team. They definitely on the front lines of this have evolved to take care of everyone. They are positioned to surge, should we need it. And they've just been a steady, constant competent team the entire time. So yes, we're still trauma, still taking care of, life is still happening, Jeff.
Yes, it
we're
is.
Getting strokes, we're getting heart attacks, we're getting trauma alerts. People's lives are continuing on, and through all of this, they're staying strong and welcoming everyone that comes to the door.
Right on, right on. Eric, we'll throw it to you. Anything you'd like to tell the folks? You're the Escambia County Emergency Management Director. What would you like to tell folks who might be tuning into this video?
First and foremost, I'd like to thank the hospitals because we're having a community-based testing. We know what we have in our community. I've been on many calls where a lot of counties don't have the capacity that we have here in Escambia County with the testing that you guys are doing. And let me tell you, that's huge. That's huge. So there's some counties out there that are feeling scared, or they feel like they're behind the ball. So they don't know. They got very few testing sites going on, and very few tests being done. So first and foremost, thank you, and for all your staff's doing. Secondly, the community, the overwhelming for the community. We had a PPE drive Friday. We received 1,495 masks.
Wow.
Unity. I know Justin said he's getting supplies as well. We've got 2 drop-off locations. Hillcrest Baptist Church is helping us out with the PPE, receiving it so we can go out, pick it up, and redistribute it to the hospitals and the healthcare community. So the community has done they never cease to amaze me. This community has always been great in answering the call, and I just want to thank people out there. And as Justin said, continue doing what you're doing. We'll get through this together. Continue doing what you're doing, and we'll make it through this.
Outstanding, Eric. And Janice, I'll throw it over to you as the county administrator. I know you've been putting in long days. We did hire you some help finally at long last. 8 months in, we finally got your 2 deputies. So give us an update on how that's going. And then, of course, just so everyone knows, our committee of the whole this week, the Board of County Commissioners, Chairman Stephen Barry has canceled that meeting. And then next Tuesday, we were going to have a regular meeting as well, and that one's been canceled. So it looks like the Board of County Commissioners, in an abundance of caution, we're going to move forward through this month without having meetings. And we've got the emergency declaration, which has empowered Janice to kind of act on our behalf in absence of meetings. But with all that said, Janice, what would you like to say to folks? And do you have an update on your new assistants?
Yeah, so first of all, I would just absolutely echo everything that Eric said in terms of gratitude and thankfulness to the community. And then I think also to Dawn and to Justin and to the other healthcare organizations that we have that are just doing an absolutely yeoman's job in terms of serving our community. We are very blessed in this community to have major medical facilities that just attend every day, go above and beyond. As Dawn said, there are still regular emergencies that are going on.
Yes.
Pardon me. I did want to mention that the county employees are also still working very hard. We have given them the opportunities to work from home if they need to, or if they feel vulnerable, or if they're in that age group that they feel like they need to take that opportunity. But for the most part, I would say that our employees are all still wanting to report to work and continue to provide the services that they provide our county. And so I'm very thankful to them. We have done thousands of permits. We've done thousands of inspections still. We're still transporting people with our ECAT. As you know, the jail, is still providing services. So, I would just say, and we're doing a lot of garbage pickup. I will mention that. People are cleaning out their houses, and our solid waste facilities are seeing a lot of traffic out there. So, as much as we can, we're still trying to provide you normalcy in your life. And I would just close like I have before. I do have Debbie starting today, which is one of our new county assistant administrators. And then we'll have Wesley will start the first week of May. And I just appreciate the board's support in that so much, because I feel like the 9 months that I've spent doing this as the administrator has been helpful. So now that I know when I ask them to take over roles and responsibilities, I know exactly what I'm asking them to do. So I think while it has been a long road, I think it was an important road to travel. But I would just finish with this. I do think that because people have gone home and are a bit isolated, let's not let our neighbors be alone by themselves at home. Find ways to communicate. I think Stuart made the comment, let's not say social distancing, let's say physical distancing. So let's still like you're doing with the Zoom, or you can do with your phones or anything else, from the yard. Make sure that you're communicating with your neighbors and don't let people be isolated. I've heard Chip Simmons and the sheriff talk about we have to keep an eye out for ticks up in domestic violence and things like that. And so we just need to be very cognizant that these are very trying times for people maybe from an employment standpoint, but also maybe from a quarantined, everybody's all together in the house, and maybe maybe people get on each other's nerves a little bit, right? But let's just make sure that if there are people that you need to continue to stay in contact with, that you do that. Don't let people be isolated and lonely. Don't let people find a way to suffer either any depression or anxiety by themselves, and make sure that people are reaching out and providing them support. I think that's what makes this community so special. People don't leave people alone, and I think that's very helpful. And I think we will come out of this much stronger on the backside.
I agree. Well, Janice, thank you so much for getting up early and being here. I know you probably get up this early anyway each day and work. Eric, thank you for being here. And of course, Don Rudolph, thank you so much for taking your time. I know you guys are super busy. Justin Labrato, thank you for being here, guys. I will say next week we're going to do this meeting. We're going to do this weekly. I'm going to compile questions just as I've done this week. Next week, our special guest will be Gay Nord, who's the president and CEO of West Florida Hospital. We look forward to having her aboard. And of course, Janice and Eric, I've asked them to be here as well. So to all the folks, one of these days we'll get back to the Hardee's, the McDonald's, the Denny's, and sit down together and have coffee together. I hope that we can get to that point. Meanwhile, everyone, please stay safe. Follow the guidance of the CDC. Follow the guidance that you're hearing from the local officials. And just like Janice said, take care of one another. And we will all get through this together. And again, I will reiterate my thanks to everyone, every nurse, every healthcare worker who's on the front lines of this, every research scientist who's working on the vaccine and the tests. We appreciate it. And I appreciate this platform and being able to get this out to the citizens. So look forward to seeing you next week at the 35th Coffee with the Commissioner. Until then, everyone have a great day. Thank you.